You have regular periods, you're tracking your cycle, you're timing your intercourse perfectly, and yet month after month, you're getting negative pregnancy tests. Does this sound familiar? If you're watching this, you're probably thinking, my periods are normal, so why can't I get pregnant? And I get it. This is one of the most frustrating situations to be in because on the surface, everything looks fine. Your doctor might even have told you that everything is normal. But here's what I need you to understand. Having a regular period does not automatically mean you're ovulating properly. It definitely doesn't mean that everything else in your fertility picture is optimized for conception. Hi, I'm Dr. Marc Sklar, also known as the fertility expert. And for over 24 years, I've helped thousands of women solve this exact puzzle. Women who were told everything was fine, but still couldn't get pregnant. And what we discovered were hidden issues that standard fertility testing completely misses. Before we dive into these 5 hidden reasons, I want you to grab my free guide. This is the proven 6 ways to improve egg quality in 90 days. Even if you think your cycles are perfect, this guide will show you how to optimize your fertility from the inside out. I'm going to leave that link in the description below. Today, I'm going to reveal the 5 hidden reasons why you have regular periods but still can't get pregnant. And more importantly, what you can do about it. So let's dive in. The first hidden reason is probably the most shocking. You might not actually be ovulating at all, even though your period shows up like clockwork every month. This is called an anovulatory cycle, and it's way more common than most people realize. You can have what appears to be completely normal period without releasing an egg. What's actually happening is your body is building up the uterine lining through estrogen, but without an ovulation, there's no progesterone surge. Eventually, the lining sheds, giving you what looks and feels like a regular period. You can only get pregnant if you release an egg. It doesn't matter how perfect your timing is, how healthy your lifestyle is, or how regular your cycles are. If there's no egg, there's no chance of conception, period. The tricky part is that anovulatory cycles can happen even in women with textbook 28-day cycles. Your period might be regular as clockwork, but underneath, ovulation isn't actually occurring every month, or the quality of ovulation is poor. So how do we identify this? Standard period tracking is often not enough. Here's what you need to do. First, start tracking your basal body temperatures, BBT. After ovulation, progesterone causes a sustained temperature rise of about half to a full degree. That lasts until your period comes. If you're not seeing this biphasic pattern, meaning a clear temperature shift and sustained elevation, you may not be ovulating. Second, use ovulation predictor kits or OPKs, but understand their limitations. OPKs detect the LH surge that should trigger ovulation, but they can't confirm that ovulation actually happened. You can get a positive OPK and still not ovulate. Third, and this is crucial, get your progesterone levels tested about 7 days after suspected ovulation, which is typically around 21 of a 28-day cycle. Progesterone should be above 10 for ovulation to have occurred, but ideally, we want to see it above 15 for optimal fertility. If you're not ovulating regularly, we need to confirm why. Common causes include PCOS, thyroid dysfunction, high prolactin, extreme stress, low body weight, or excessive exercise. Each of these has different solutions. In the HOPE program, we use comprehensive hormone testing to identify exactly what's disrupting your ovulation. And then we create a targeted protocol using nutrition, supplementation, lifestyle modifications, and sometimes herbal medicine to restore healthy, consistent ovulation. We don't just get you to ovulate. We optimize the quality of that ovulation so your eggs are mature and ready for fertilization. Hidden reason number 2. Poor egg quality. And listen, this is one that nobody wants to talk about, but it's absolutely critical to understand. You can be ovulating regularly, but if the quality of your eggs is compromised, conception either won't happen or won't be sustained. This is often the hidden factor behind unexplained infertility and recurrent early miscarriages. Think of your eggs like seeds. You can have perfect soil, perfect watering, perfect sunlight, but if the seed itself is damaged, it's not going to grow into a healthy plant. Your egg needs to have the right chromosomal content, healthy mitochondrial, the energy powerhouses of the cells, and the ability to be fertilized and developed properly. Poor egg quality affects your ability to conceive in the first place, the likelihood of a successful implantation, your risk of early miscarriage, your chances of having a chromosomally normal pregnancy. Here's something that most women don't realize. Your egg quality right now is not set in stone. The eggs that will ovulate in the next 90 days are going through their final maturation process right now. That means you have a 90-day window to dramatically improve your egg quality. You might have poor egg quality if you're experiencing the following things: difficulty getting pregnant despite regular ovulation, early miscarriages, especially recurrent, failed fertilization with IUI or IVF, poor embryo quality in IVF cycles. This is where the whole program really shines because we have specific protocols that target egg quality improvement. First, nutrition. Your eggs need high quality protein, healthy fats, especially omega-3s, and plenty of antioxidants. Think of wild-caught salmon, organic eggs, colorful vegetables, berries, nuts, and seeds. Second, key supplements. CoQ10, specifically ubiquinol, is crucial for mitochondrial function in your eggs. We also use ALA, alpha lipoic acid, vitamin D, folate, not folic acid, and other targeted nutrients based on your specific needs. Third, reduce oxidative stress. This means eliminating processed foods, reducing toxin exposure, managing stress, and getting quality sleep. Oxidative stress damages your eggs at the cellular level. Fourth, support blood flow to your ovaries through acupuncture, castor oil packs, and specific exercises that improve pelvic circulation. Now, if you're watching this and thinking, this is a lot, how do I know what I specifically need? This is exactly why you need to book a fertility assessment with me or my team. We'll look at your age, your health history, your current symptoms, and any previous testing to create a personalized egg quality protocol for you. Don't leave this to chance. Book your fertility assessment using the link in the description below this video. Okay, the third reason is a luteal phase defect, also called a short luteal phase. This is incredibly common and most women have no idea that they have it. Your luteal phase is the time between ovulation and your period. This is when the corpus luteum, what's left after your egg is released, produces progesterone to prepare your uterine lining for implantation and support early pregnancy. Here's the problem. A healthy luteal phase should be at least 12 to 14 days long. If your luteal phase is shorter than 10 days, there's not enough time for proper implantation, or your progesterone levels aren't high enough to support early pregnancy, even if implantation does occur. Many women with luteal phase defects get pregnant, but then experience early miscarriages, sometimes what might be called the chemical pregnancies. Sometimes even before they get that positive pregnancy test, they have that loss. They might see a faint positive that disappears or experience what they think is just a late heavy period. Count the days from your first positive ovulation test or your temperature shift until the day before your period starts. This is your luteal phase length. If it's consistently shorter than 12 days, you likely have a luteal phase defect. Also pay attention to these following signs. Spotting before your period, especially more than 2 days before. Very short cycles, 12 days or less. Low progesterone, meaning below 10,7-DPO, and then PMS symptoms starting immediately after ovulation. Luteal phase defects are usually caused by the following things: poor ovulation quality, meaning weak ovulation produces a weak corpus luteum. Thyroid dysfunction, especially subclinical hypothyroidism. High stress and elevated cortisol, which competes with progesterone production. Nutrient deficiencies like B vitamins, vitamin C, and magnesium. Low cortisol. Your body makes hormones from your cortisol levels. The conventional approach is to just prescribe progesterone supplementation, and while that can help, and I often have to use that, it doesn't address the root cause. In the HOPE program, we dig deeper to understand why your luteal phase is short and fix the underlying issue. This might involve supporting better ovulation quality through nutrition and targeted supplements. May also need to address thyroid function, even if your doctor says that your thyroid's normal. Implementing stress management techniques and adaptogenic herbs where needed. Using specific nutrients like vitamin B6, vitamin C, and magnesium to support progesterone production naturally. Sometimes using herbs like Vitex to support corpus luteum function. The goal isn't just to add progesterone, it's to help your body produce adequate progesterone naturally and maintain it throughout your luteal phase. The fourth reason, inflammatory conditions, particularly silent inflammation that doesn't show obvious symptoms but is destroying your fertility from the inside. This is one of the most overlooked factors in unexplained infertility, and it's become epidemic in our modern world. Silent inflammation is low-grade, chronic inflammation that doesn't cause obvious pain or swelling, but it's constantly active in your body. It's like a fire smoldering under the surface, damaging your reproductive system without you even knowing it. This inflammation affects fertility in multiple ways. It damages egg quality at the cellular level. It interferes with proper implantation. It can prevent fertilization. It disrupts hormone production and balance. It affects your immune system's response to pregnancy. Here are some common sources of silent inflammation. Food sensitivities you don't know you have, like gluten, dairy, and eggs, are some of the more common ones. Poor gut health and intestinal permeability, or what's called leaky gut. Chronic infections, including dental infections and low-grade bacterial overgrowth. Environmental toxin exposure, high stress and poor sleep, blood sugar imbalances, and insulin resistance. Conditions like endometriosis, PCOS, or autoimmune issues, even if mild or undiagnosed. You can't always feel inflammation, but there are clues, and some of them are digestive issues like bloating, gas, irregular bowel movements, skin problems like acne, eczema, or rashes, joint aches or muscle pain, frequent headaches, allergies or sinus issues, fatigue that doesn't improve with sleep, difficulty losing weight despite diet and exercise. Testing can also reveal inflammation. You should test for high sensitivity C-reactive protein, elevated inflammatory markers, food sensitivity testing, comprehensive stool analysis for gut health. To address inflammation, this requires a multifaceted approach, which is exactly what we do in the HOPE program. First, eliminate inflammatory foods. We've already talked about processed sugar, trans fats, and conventional dairy in previous videos. These are all highly inflammatory. Second, heal your gut. Your gut health is directly connected to inflammation levels throughout your body. This means eating probiotic-rich foods, eliminating food sensitivities, and sometimes using specific gut healing protocols. Third, eat anti-inflammatory foods. Fatty fish rich in omega-3s, colorful vegetables packed with antioxidants, turmeric, ginger, green tea, and lots of fiber. Fourth, manage stress with prioritizing your sleep. Both of these are massive drivers of inflammation that most people underestimate. 5, reduce toxin exposure. Switch to natural cleaning products. Filter your water, choose organic when possible, and eliminate plastic containers for food storage. In the HOPE program, we identify your specific sources of inflammation and create a targeted anti-inflammatory protocol. We've seen this single intervention resolve unexplained infertility in countless women, and it can do it for you. The fifth one might actually surprise you. You might not be timing intercourse correctly. I know you're probably thinking, Mark, I'm using ovulation tests. I know when I'm ovulating, but hear me out because this is more nuanced than most people understand. The fertile window is smaller than you think. Most people believe you can get pregnant several days after ovulation, but that's not true. Once your egg is released, it's only viable for about 12 to 24 hours. That's it. If sperm isn't already waiting when that egg is released or doesn't arrive within that narrow window, conception can't happen that cycle. However, sperm can live in the reproductive tract for up to 5 days in optimal conditions. This means the best time for intercourse is actually in the days before ovulation, not on ovulation day or after. OPKs detect your LH surge, which typically happens 24 to 36 hours before ovulation. By the time you see a positive OPK, you're already close to ovulation. If you wait until you get a positive to have intercourse, you might be too late, especially if you only have intercourse once and your partner has low sperm count or motility issues. The optimal approach is to have intercourse every other day from about day 8 of your cycle through day 18. for a typical 28-day cycle. This ensures there's always fresh sperm waiting when the egg is released. If that's not realistic for you or your partner, then focus on having intercourse 2 days before expected ovulation, 1 day before expected ovulation, and the day of ovulation. You can identify these days by tracking cervical mucus. You want that egg white quality mucus, clear, stretchy, slippery, sticky. Using OPKs and having intercourse the day you get your first positive and the day after tracking basal body temperature, though this is more useful for confirming ovulation after the fact. Some couples actually have too much intercourse, which can lower sperm count and quality. If your partner has borderline sperm parameters, every other day or every 2 days better than every day. I have to tell you a story of a woman who thought she was ovulating on cycle day 11. She thought this because when she used her OPK, she got a surge on cycle day 11. So she stopped testing. I asked her to continue to test every day until she got a negative test. I also asked her to test twice a day, 12 hours apart. What she found out was that her LH was rising on cycle day 11, but she didn't actually peak until cycle day 14. She was mistiming intercourse because she stopped testing. Make sure you know when you're actually surging. In the HOPE program, we don't just tell you when to have intercourse. We teach you how to read your body's fertility signals, how to track your cycle accurately, how to optimize both timing and quality of your eggs and your partner's sperm. We look at the complete picture because timing means nothing if egg quality, sperm quality, or other factors aren't optimized. Now, here's something really important I need you to understand. In most cases, it's not just one of these hidden reasons. It's a combination. You might have slightly impaired ovulation quality, plus some inflammation, plus short luteal phase. No single factor is severe enough to get flagged as abnormal in any standard testing, but together they create the perfect storm that prevents conception. This is why conventional fertility treatment often fails. They're looking for obvious diagnosable problems. They run basic hormone panels, check that you're ovulating, do an HSG to confirm your tubes are open, and check your partner's sperm. When everything comes back normal, they label it as unexplained infertility and push you toward IVF. But here's the truth. There's no such thing as unexplained infertility. There's only infertility that hasn't been properly investigated yet. In the HOPE program, we go 10 layers deeper than standard fertility testing. We look at your complete hormone picture, not just FSH and LH. Your thyroid function, including antibodies that most doctors don't test. Your nutrient status and potential deficiencies, your inflammatory markers, your blood sugar regulation and insulin sensitivity, your gut health and potential food sensitivities, your stress hormones and cortisol patterns, your exposure to environmental toxins, your partner's sperm, DNA fragmentation, not just basic parameters, your lifestyle factors, sleep quality and stress levels. When we address all of these factors comprehensively, that's when women who've been trying for years suddenly get pregnant. It's not magic. It's addressing the complete picture instead of just putting Band-Aids on your symptoms. So what should you do if you have regular periods but still can't get pregnant? First, don't wait. If you're under 35 and have been trying for more than 12 months or over 35 and have been trying for more than 6 months, you need to take action now. Egg quality declines with time, and whatever is preventing pregnancy isn't going to fix itself. Second, get comprehensive testing. Don't settle for everything is normal. Find a provider who will dig deeper and look at all the factors I've mentioned today. Third, make lifestyle changes now. While you're investigating the root cause, start optimizing your nutrition, reducing inflammation, managing stress, and improving sleep. These changes benefit your fertility regardless of what the specific issue is. Fourth, track your cycle properly. Start monitoring basal body temperature, cervical mucus, and using OPKs correctly so you have actual data about what your body is doing. Fifth, and this is crucial, get support from someone who specializes in natural fertility and understands how to address these hidden issues. Look, I know how frustrating and isolating this journey can be. When your periods are regular and all your tests come back normal, you start to feel crazy. You start to wonder if it's all in your head, or if you're just unlucky, or if your body is somehow broken. But I'm here to tell you, Your body is not broken. There are answers and there are solutions. You just need someone who knows where to look and how to connect the dots. This is exactly why we create the HOPE program. It's not about me. It's about a proven system that I've refined over 20 years of helping women just like you finally get pregnant naturally. We don't do cookie cutter protocols. We don't do one size fits all. Every woman's fertility journey is unique, and that's exactly how we treat it. With personalized testing, individualized protocols, and comprehensive support every step of the way. The HOPE program addresses all 5 of these hidden reasons and more. We optimize your ovulation quality, improve your egg health, correct luteal phase issues, reduce inflammation, and teach you how to read your body's fertile signs. We look at your hormones, your gut health, your nutrition, your stress levels, your environmental exposures, everything. And more importantly, we don't just give you a protocol and send you on your way. You get ongoing support, weekly coaching calls, access to our team, and a community of women who understand exactly what you're going through. If you're ready to finally get answers and stop wondering why you can't get pregnant, I invite you to book a comprehensive fertility assessment with me or my team. In this one-on-one call, we're going to dive deep into your health history, your symptoms, any testing you've had done, and create a clear roadmap for exactly what you need to do to get pregnant. This isn't a sales call. This is a genuine opportunity to get clarity, ask your questions, and understand what's really going on with your fertility. You can book your fertility assessment using the link in the description below this video. And don't forget to grab that free guide I mentioned at the beginning of the video, the proven 6 ways to improve egg quality in 90 days. Even if egg quality isn't your primary issue, these strategies will support your overall fertility. That link is right there in the description as well. Before you go, subscribe to this channel and hit that notification bell so you don't miss future videos. I'm constantly sharing new strategies, insights, and solutions to help you get pregnant naturally. If this video gave you some aha moments or helped you understand what might be going on, please share it with a friend who's struggling to conceive. This information could change someone's life. I believe in you. I believe your body can conceive naturally, and I'm here to help you make that happen. Until the next video, stay fertile and stay hopeful.